Do you have a high blood pressure or do you experience heart failure? Then it might be that your doctor prescribed you Enalapril, also known as Vasotec. In this video we will cover how and when to use it, what side effects it can cause and much more. So make sure to watch the whole video so you don't miss any important information. And for those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and it's my mission to medically educate you, my viewer, so you can make healthier decisions. So let's get learning. So the generic name of this medication is Enalapril and is available under the brand names Vasotec and Renitec. And you can use it as a tablet or an oral suspension. Which brings us to how to use it. If you want to use it as a tablet, just swallow the tablet whole with half a glass of water. If you want to use it as an oral suspension, then measure the precise amount you need to take with a measuring cup. Take this amount and afterwards rinse the cup with some water and drink this water as well. Now, Enalapril is part of a group of drugs called angiotensin converter enzyme inhibitor. This drug widens blood vessels, thus lowering blood pressure and lowering the strain on the heart. Therefore, Enalapril can be used to treat high blood pressure and heart failure. Which brings us to the correct dosages to use, and here I want to mention that I can only provide you with some guidelines. Always use the prescribed amount and frequency your doctor gave you, as specific dosages might depend on your indication of use, the severity of your symptoms, or the side effects you might experience. However, when treating high blood pressure in adults, most doctors will start with an initial dose of 5 to 20 milligrams once per day, which if necessary can be slowly increased up to a maximum dose of 40 milligrams per day. When treating heart failure, the initial dose is much lower and needs to be built up over a longer time. Ultimately, the maintenance dose, however, will be about the same, 20 milligrams once per day, up to a maximum of 20 milligrams 2 times a day. Now, Enalapril can be a very effective drug, but unfortunately it can also cause some side effects. I will discuss some of the most common ones in this video, but if you're looking for a complete list, then check your leaflet, ask your doctor or your pharmacist. Very commonly it might cause dizziness, a blurred vision, a cough or nausea. Commonly it can cause low blood pressure, fainting, abdominal pain, a rash, fatigue or a depression. Uncommonly it might cause palpitations, a heart attack, dizziness, confusion, vomiting, constipation, a tinnitus, fever or erectile dysfunction. And rarely it can cause several serious adverse reactions. Which brings us to the safety of use. And here it is important to mention that the first few days you're using Enalapril, it can cause dizziness or fatigue. If you do experience these side effects, then please do not drive as it can be dangerous. Furthermore, alcohol widens the blood vessels and it can therefore increase the side effects you might experience when using Enalapril. Try drinking alcohol in moderation first so you can estimate its effect on you. In addition, Enalapril can also cause interactions with other drugs you're taking, so be careful. Lastly, Enalapril can be dangerous for women which are pregnant and it can usually be used safely for women who are breastfeeding, but always discuss this with your personal doctor. Now, I hope you know now how to use Enalapril, but if you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. For those of you that want to keep on learning, check out the playlist in the description with more awesome cardiology videos. And for those of you that did learn something, please click the like and subscribe button. It will help out the channel tremendously. And I want to give a special thanks to my Patreon supporters. Thank you, Sebastian, who's an Vasotec supporter. And for those of you that can't get enough, check the Instagram out as well at How to Mitigate. Otherwise, I will see you next week with a new video. Bye bye.